Okay, and so we'll just dive right in. Oh, and also as we're going, I have some questions prepared for Ms. Amaya Fuentes, but if there are questions you have, hopefully, feel free to type those into the chat, and I will make sure that they get asked. Okay, so Roxana, would you mind starting us off by just giving us a little intro on who you are, what you do?
Mhm. Yeah, sure. Hi, everyone. It's so great to be here. And thank you, Lauren, for reaching out. Like she mentioned, my name is Roxana Amaya Fuentes. I have an MPH from the George Washington University, and I currently work at the Children's Environmental Health Network in Washington, D.C. And also, I am part of the Cancer Free Economy Network, another nonprofit organization that focuses on reducing environmental health exposure hazards, and human health.
Thank you. And so for our first question, I'd like you to take a little bit of time and just describe what you studied and what your activities
Mhm.
were while you were at UMD as a student.
Yeah, sure. So my major in undergrad was actually family science. At the time, I was interested in pursuing a career in the mental health field. And so also during this time, I took the opportunity to seek out internships. So I had the opportunity to work at two outpatient mental health centers where I gained more insight into what it's like to work in the field. And also, the majority of the families that we work with were Latinos. And after undergrad, I was offered a position of providing family support at one of my internships. And after that, I became the program coordinator of the family support group, and I was making sure that families were receiving like high quality mental health services or addressing any other needs that they had. And also, when I was at UMD, I was part of the Latinx Student Union during my time there.
Excellent, thank you. I love you come from that kind of background of the family sciences and then moved into the side of environmental health. I think a lot of students sometimes think it's a very like science oriented
Hmm.
position, but there's really so many different paths you can
Yeah.
go down. Um, So you kind of touched on this, but we'll move naturally into the next piece, which is how slash when did you decide you wanted to go into the environmental health field, and how did you first kind of bridge that jump?
Yeah, my journey into the environmental health field was something that I hadn't planned. Like you mentioned before, Lauren, I initially thought that it was going to be like a really sciencey field. But in my MPH program, I did have like a lot of students who came from like various backgrounds. For example, like English, biology, history. So there's really like a lot of room like to really explore that field if that's something that you're interested in. But initially, like I wasn't even like thinking about attending grad school at the time. My plan after undergrad was to gain work experience and really explore what I wanted to do after that. And I was really set on pursuing a counseling career. But during my last semester of undergrad, I took a research methods course. And that was the first time that I was exposed to public health research, and I really enjoyed it. And the class was challenging, but I enjoyed the process and developing like our own research topic with my team. And at the time, we won second place at the symposium for families. And so, out of curiosity, I started doing my own research about potential careers in public health that involved research. And that's when I learned that I needed an MPH to take a step towards that direction. So, I took a year off to prepare for grad school because I'm a first generation student. So, the application process was a bit stressful. And because I was doing all of this for the first time, but I had like a lot of guidance from career services on campus. They helped me review my resume, my personal statement, and they really guided me like through all the steps. And after going through the process, I decided to attend George Washington University. And initially, I had applied to their prevention and community health program. But my second semester, I took my first environmental health course, and this was part of our program's requirements. And ever since I took that class, it was just really eye-opening for me, and it definitely gave me a unique angle of health that I had not considered before. And it was an area that I found myself so passionate about, and I found myself also having like a personal connection because the concerns that are addressed under this public health umbrella disproportionately affect low-income communities and communities of colors, like the one I grew up in, everywhere. So at the end of that semester, I made a decision to change my concentration, and I really don't have any regrets doing that. And I am enjoying the work that I'm currently doing, and I'm still continuing to learn in that field.
Excellent. Thank you so much for sharing a little bit of that very interesting journey, that kind of awakening a little bit later
Yeah.
in the career process. Just shows it's never too early to or too
Yep.
late to kind of change your mind or find a new path or a new passion. Um, so that, you keep setting me up perfectly for the next question, which is in your current role as the Eco Healthy Child Care Program Assistant for the Children's Environmental Health Network. Can you describe kind of what your current role is? What does it look like? What are your main responsibilities? What do you like? What are the challenges? And then if you could also talk a little bit more broadly about the work of the Children's Environmental Health Network and kind of what it does.
Yeah, sure. Children's Environmental Health Network, it's a national nonprofit organization, and so our mission focuses on protecting children from environmental health hazards and promoting a healthy environment. And we're also close to celebrating our 30th anniversary, so that's very exciting. We have planned like a couple of activities, and so the main focus of our work is looking at that intersection of health and environmental health hazards. For example, exposure to pesticides, toxic chemicals, whether it's in consumer products, air pollution, promoting research that focuses on prevention, and also advocating for those policies that place children at the center. And throughout the years, some of our accomplishments have been that in 1990, we created the first pediatric environmental health curriculum. And that curriculum was updated recently, like in 2014, and has a lot of like instructional tools related to environmental health and children's health. And we also sponsored the first research workshop on children's environmental health. This was bringing together researchers from this different disciplines to really focus on merging the pediatric and environmental research. And also the results of that workshop indicated that there's still like some gaps in the field. And I've been with the organization for a year and 6 months now. I transitioned into that role as of July of 2020, so it was like in the middle of COVID. So that was a very interesting transition, and I didn't get to meet my coworkers in person until this September. And our Eco Healthy Childcare program, so this is managed within CHN, and it's an award-winning and science-based program, and it is the only national environmental health endorsement program for early care and education providers. So also the program focuses on protecting children and the providers from environmental health hazards within childcare facilities. So this also includes center or home-based. And so I work closely with the program manager and the director to continue expanding our program. We work closely with childcare professionals and other, uh, for example, like providers, nurses, pediatricians, to be able to reduce those environmental health hazards within the facilities. And so our program endorses those childcare facilities that meet 24 out of the 30 best practices. We have a checklist that is available in both English and Spanish that providers can follow and check off, and to make sure that they are really meeting those standards and best practices. And the endorsement is valid for 2 years, and then it needs to be renewed. We also offer free to low cost solutions for those facilities that are still in the process of working towards their endorsement. So, for example, some of those are using cold water when preparing powder formula, selecting fragrance free products, or placing a rough mat at the entrance of the facility for everyone to wipe their shoes after being outside. And our program has endorsed over 3,000 childcare facilities. So that's serving over 80,000 children within 49 states and six Canadian provinces. That also includes five Australian states and Puerto Rico. And we also have train courses in 33 states. And also, we're trying to work more with states' quality rating improvement systems. And so far, Maryland has incorporated our EHCC program into their state QRIS system. It's called Maryland Excels, and they offer providers an eco-friendly achievement program, eco-friendly badge for those licensed childcare facilities that have become endorsed. And also, as part of being part of the organization, this has also introduced me to Cancer Free Economy Network that I have mentioned earlier. So, another nonprofit organization where it's just like a network where individuals come together to address environmental health concerns that BIPOC communities face. So currently, I am the Market Shift Node coordinator. So I work closely with the group's chair and co-chair to carry out activities or projects that focus on decreasing exposure to harmful man-made chemicals in products. So, for example, one of them is food serviceware, and I am also one of the Emerging Leaders Cohort Co-Program Manager. So the Emerging Leaders Cohort Program is a mentorship type of program, and I work together with the other co-program manager and the strategic director to lead this program. So we focus on also like mentoring BIPOC individuals to be able to prepare them and encourage them to take leadership roles within the network and also at their home organization. So yeah, back to you.
Awesome. Thank you. And do you mind also just saying, kind of on a day-to-day basis, what does your current role look like for you? Like, what are kind of some of the functions? What are you doing on a day-to-day?
Yeah, so on a day to day, for me it's like I spend time reaching out or working like with our teams like collaborators, also looking at like the latest research that focus on children's health or environmental health in general, and also doing like some outreach. Currently we're really trying to like really expand our program and also trying to work like with states to incorporate our EHCC program like into their QRIS system. So this will also not only allow us to continue the expansion of our program, but also making sure that to increase that awareness like of environmental health that isn't always very obvious like within like the childcare field.
Great, thank you. This is just a reminder to all of our attendees, if you have any questions, please feel free to put them in the chat. And I will, of course, make sure that those get read out and answered. Um, so moving on to our next prepared question, which is something maybe you can answer from personal experience as well. What do you think is something that is misunderstood about the environmental health field?
Um, I I think that it's an area where the connection between environmental health and human health is not always obvious, or it may not be taken into account when I think that it's really integrated like into everything. Like from like air pollution to maybe like what the materials like in our homes are made out of. And I think that this is also something that we also come across in our work. Like I mentioned before, the connection between childcare and environmental health is not always obvious. So at times it can also be challenging to start these conversations, or it may be overwhelming because there's just so much information. But in our work, we have found that finding like a common area to be able to engage with providers or other childcare or health professionals has been helpful, kind of just to start as like an entry area or point of discussing other environmental health topics. And then this can lead to like a more in-depth conversation about other things like pesticides or lead or even like the chemicals that can be found like in day-to-day like consumer products.
Thank you. Yeah, I think just the ubiquity of environmental factors and how they affect our health. And you brought up earlier that often these factors affect our BIPOC communities or
Hmm.
uh, more than in more substantial ways. Do you see that in the work that you do in your current role? Do you work, is that represented, or how do you see that playing out in your current work?
Yes, I definitely do see that as part of my work. Our program has also been part of a Choose Safe Places work. So this is something that has been funded by the ATSDR, and the Choose Safe Places focuses on basically identifying those childcare facilities that are close to like any like environmental health hazards. Like so, for example, near like a CAFO or facilities that are placed or have been like been built like near facilities like a laundromat or like a gas station. So just being like in proximity to these facilities can also be harmful like for children and the providers. And also these tend to also be found mostly like in low income or communities of color, so that really increases their environmental health hazard exposures. And when facilities are built like near these other harmful other facilities, it can also be challenging to address because you can't just, simply move a facility somewhere else. It's very challenging. And also, in, we found that sometimes, like in communities of color or low income communities, that there tends to be less licensed like childcare facilities. So that I think that also just having access to quality like childcare can also be challenging, like for those communities as well.
Yeah, thank you for sharing those
Mhm.
insights. So we do have a student question, but I'm going to go ahead and ask
Mhm.
the last question in our series, and then I'll jump in. So keep putting those questions in the chat, and they will get answered. Um, so, what are the top tips you would give to a current student hoping to enter the environmental health field, and what do you wish you knew back in undergrad?
Um, well, some tips that I would give is don't be afraid like to dive into this field, even especially like even if you don't have like a super hardcore like science background, because I know that was something that I personally struggled with when making that decision to explore and like transfer to that field. Like I had taken just like the general like science courses that provided like a good foundation, but it's something that as you dive into the field, you just, if you really have like the passion and like the interest, then it's really not like a big deal to start really like learning or diving deep into the science. And also, I just think that, if you really just have like an interest or a passion like for the field, to really, don't be afraid to maybe like talk like with some individuals that are already like in the field, to like really explore like how like they got to that point, or what kind of like interesting projects like they're working on. And definitely I would say, gain experience, because I think that what has really helped me a lot, especially when making that transition to the environmental health field. I found that it like a bit challenging because I came from a more like social and behavioral type of um, field, and also like studies, and like the previous experiences that I had only been in behavioral science. But I also found that that was also really helpful, especially when addressing like or exploring like climate change related work. The mental health aspect sometimes gets left out of like that conversation, and I think that's also important. And while I was working in the mental health field, I did notice like some connections I was working with kids who had experienced like floods or any other natural disaster, and I really did see that connection, like that their mental health like was affected. And then but then you know that created like a lot of anxiety for them, like they fear that those events would occur again or how it would like affect their families. So we really had to work like through that. So that was a very interesting connection that I made while working and still like completing my MPH. And it's something that I wish I would have done like earlier was also just exploring exploring more on like the public health field, and also getting involved like in research to see if that's something that you're interested in. And then that's something that I definitely wish that I would have gotten like involved with like earlier. So then that way I could have started getting like more experience. And that experience I was also able to gain during my MPH while doing internships. Like I went to like the school labs to get that research experience. And also I had done like an internship at the Pan American Health Organization in Washington, D.C. So that also exposed me more to public health like communications, and also learning how to work with like other like stakeholders and working as a team. I also wanted to add that we also have internships available in like health communications, like in the fall, spring, and summer, like if anyone is interested.
That's great. Yeah. Do you have a link to that that you would be able to share either in the chat, or if it's not readily available, you can send it to me after and I can follow up with that.
Okay, yeah,
And we can also talk about getting that shared a bit more broadly too, because I'd love
sure.
to
Yeah.
get that information out to our students. Um, well, thank you for kind of running through those set questions we had. We do have a couple questions in the chat here. So, and if this is a bit broad, feel free to answer, at your level of expertise, or
Mhm.
other suggestions you might have. But so, in addition to kind of your realm and what you do within the field of environmental health, what other kind of types of careers in environmental health have you either observed or know about? And then, what would you say are the kind of skills and experiences recommended for the field?
Um, in terms of skills that are recommended in the field, I would say, definitely having like even just like a general like science background, but if you can really dive into it more like at some point, I highly recommend that. And also research, and definitely like enjoyment of reading, because there's like a lot of reading, especially when it comes to like research and looking at like scientific papers, and definitely like paying attention like to detail, but also at the same time being like creative and open-minded. And I feel like there's just so much under also like the public health umbrella like to be explored. For example, like I'm personally like interested in toxicology, so just I would like at some point like to dive a lot deeper like into the science, but also collaboration is also like another important skill, because like you just can't do everything like by yourself. So we also do like a lot of collaborations, and just fostering or even just like creating those new relationships. I've also noticed that is very important, because there's just so much to address that you just can't do it by yourself. And being able to collaborate like with others just really helps you also not just like enhance your skills, but also learn like from others, and being able to collaborate together to address some of those problems, because then like you might have like a certain set of skills that is very helpful, and then another colleague has the same thing, and then like when you work together, I found that that has been like really powerful in being able like to move like certain types of work.
Awesome, thank you. Yeah, and so Roxana, you kind of represent a little bit more the programmatic side of environmental health.
Mhm.
There's, you mentioned there's also people who do, a lot more like science-based research
Mhm.
about, kind of oh gosh, like all over the field. But so you can get really involved in, for example, at University of Maryland right now we have um, professors Sapkota, because it's Amir and Rebecca, but or Amy, and they are working on reclaimed water for irrigation, right? So ways to kind of conserve. There's also working in, environmental health policy as well. You have environmental health is a component of, workplace safety as well. So, there really are ways to work based on your own specific interests and skills and within the field of environmental health. I think one of the things that Roxana was saying about, reaching out and connecting with professionals in the
Mm-hmm.
field is one of the best ways that you can really start to explore different possibilities. And that starts with faculty, with professors that you
Yes.
have in classes that you're interested in. Coming to these events and connecting with Roxana afterward. Also making sure you have a LinkedIn and just exploring
Yeah.
on LinkedIn. Alumni from UMD. That's how I found Roxana. I
Yeah.
just looked in our alumni network and then I found her there. So, really using the resources you have to find individuals you're interested in and asking them how they got to where they are
Mhm.
is a really great way to kind of start building that knowledge.
Yes, Lauren, if you don't mind, I do wanted to
Yeah.
add a few things about that. Yes, so Lauren has like a really good point. Like, definitely networking, is very, important, and not being able to afraid to just, reach out to professors or other individuals that are already working in the field. Like, for me, when I was making that transition into the environmental health field, I actually reached out to Professor Dr. Wilson. So he has like so many projects and really great work that he's doing. So one summer I just reached out to him, and we connected, and I started doing like some work in his lab and helping with some air pollution monitoring. So that also was really a great experience for me, and also just to learn more about the field. And that's how I also started learning more about in terms of like environmental justice and all the work that falls under that umbrella. So, definitely reaching out to faculty or any like professional that is working where where you want to be, or something that you want to explore, is definitely a good advice. And also, if you can also find yourself like a mentor, so that has also been something that has really been beneficial for me. Just in terms of helping you just like navigate, like what your interests are, or what you would like to do, and just also just navigating also like the challenges that you can come across like in the field as you do the work. Just finding like a mentor like that, it has been very helpful too.
Thank you, Roxana. If anyone else has any questions, please feel free to pop those in the chat. While we're waiting, I'm going to ask kind of another question, which is,
Mhm.
we talk about this a lot when you're getting started, the idea of finding a mentor or reaching out and talking with people who are doing the work you're interested in. But you kind of brought up a good topic, which is, one, you're involved in your work at the Children's Environmental Health Network kind of got you connected with the cancer
Yes.
network. I forget what the specific name of it is, but the cancer network. And then you mentioned also being interested in toxicology. So I think those are all, good points towards, the idea that even after you've kind of landed a job, there's still more to continue, right? There's
Mhm.
always growth. So can you talk about, how in your current role you seek out those opportunities for growth, and kind of how you are navigating that process?
Mhm. Uh, yes, and I think that's one of the things that I've also really enjoy about this field, that there's so much like to learn and to dive into, which at the same time can be like a little bit overwhelming, but I really enjoy that. Almost every day there's always something new like to learn, like, or dive into. And I was connected to the Cancer Free Economy Network through our executive director, and say she is part of also of this network. And initially, I was part of the mentorship program, the Emerging Leaders cohort. And as part of that program, I was the lead on one of the projects that dealt with healthy building materials and making that connection to cancer. And so, as part of that project, initially, my mentor and I had planned to develop these renovation guidelines for this cancer support space in Pittsburgh. And this was to transition to healthy building materials to decrease cancer patients' exposure to more harmful chemicals. But that project we had to take a different direction because renovation is like a really big project, and then with COVID things took like a different turn. So instead we focused on building education materials. So the education materials focused on like air pollution, consumer products, and also how to make like safety how to make safe choices like at the personal level. And so I just really started just diving into the network, connecting with other individuals, since it's more like a national organization from individuals like from all over the country. And I became part of the Market Shift group. So I started networking and connecting with other individuals there that were doing like very interesting work that I was interested in. So I kind of just started just diving into the network and navigating it on my own, just finding what I was interested in and like reaching out to those individuals that were already working within these groups and projects. And that's how also I began taking on more like leadership roles. Also, as part of the mentorship program, I started becoming more comfortable being in those positions. And because sometimes as you start out like in your career, you may feel like a little bit more like intimidated because you're working with individuals that have more experience than you. But I think that this is something that we shouldn't be like afraid like of tackling on. And like for me, that has helped me a lot, just stepping out of like my comfort zone to be able to be like in these positions, and also bringing just a new perspective, and also learning like from my other colleagues that have more experience, and that has been like really like a very good experience in terms of like my professional like and personal growth as well.
Thank you. Um, well, I'm not seeing any more questions come in the chat. So I don't know if you, before we go, want to leave us with any last few words of wisdom.
Um, I'm just, thank you for inviting me to be here. And also, like, if anyone wants to connect offline, I'm perfectly like okay with that. I can leave my email, but I'm really glad that more students are beginning to take like interest not just in public health, but also like in the environmental health field. And I'm glad to see also, like future leaders that hopefully like also help us tackle some of our most difficult challenges and issues.
Excellent. Yeah, I will be sure to share your contact information
Yeah,
when I share the recording of this.
sure.
And let's absolutely connect as well about the opportunities that you said with those internships. I will definitely share the information you provide about that, as well as kind of we can get that posted a bit more broadly. So thank you so much for joining us today, Roxana. Have a great rest of your Monday and week, and I will definitely be reaching out to connect further in the future.
Yeah, and thank you for inviting me. And I'll definitely be sending you all that information about like internships like via email.
Absolutely. All
Yeah.
right. Thank
All right.
you.
Thank you.
Okay.
Okay. Bye bye.
Bye.